My name's Alicia, and today we're going to talk about how to use sound to help you with your tinnitus. If you have ringing, buzzing, whooshing, whirring, or other noises in your head that's not caused by an external sound, then you have what's called tinnitus. Tinnitus is very common, and there are steps you can take to help manage your tinnitus better. Specifically today, we're going to be talking about sound and how you can use sound to reduce the perception of your tinnitus so it's not such an issue for you anymore. Let's dive in. Tinnitus often occurs because your brain is trying to fill in missing sounds that perhaps you're not hearing if you have a bit of hearing loss, or even if you're just in an environment that's exceptionally quiet. You can get a perception of sound. It can sound like that ringing or whooshing or whirring, and that's very common. It's called tinnitus. The trick with sound therapy is to make the tinnitus not so obvious so that you can learn to get used to the tinnitus and not be bothered by it anymore. Now, if we think about sound therapy, I want you to imagine being in a completely dark room, and now somebody lights a candle. The candle isn't all that bright, but because the room is so dark, it's so obvious and it looks really bright. Now all of a sudden, if we turn on the lights in the room, that candle, even though the brightness hasn't changed, won't look as bright. And that's because the brightness of the candle relative to the brightness all around you is what really matters. The same is true for your tinnitus. How loud your tinnitus sounds is going to be relative to the environment that you're in. The great thing about this is that that means that we can use sound as a tool to not be so bothered by tinnitus. There are different kinds of sounds that you can use to manage your tinnitus, and the right sound for you might be the different sound than the right sound for your friend, and that's okay. We can use all different types of sound, and I'm going to talk about the different options that you have. One option is to use white noise or pink noise. This would be like a shh, steady sound. You could do this with a sound machine or an app on your phone. Another type of sound you could use would be nature sounds. People often find nature sounds quite calming and soothing and relaxing, especially if you're looking at things like ocean sounds, rain. It could even be something like cicadas or fire crackling. Another type of sound you could use would be music or other low-level background sounds. If you did something like calming instrumental music, that could be a nice way to make that perception of tinnitus a little bit softer while also being relaxing at the same time. Even having the TV on in the house, just so you have a low level of noise, not interfering with conversation, but just enough so that the only sound you hear isn't your tinnitus. If you happen to have hearing loss and you wear hearing aids, then you have a really nice option where you can actually have built-in sound therapy to your hearing aids. Most manufacturers support this feature. The only caveat is that if you purchased your hearing aids at certain locations, they might not support tinnitus sound features. But if you do that, it means that you get to have the benefits of amplification and hearing better with your hearing aids, while at the same time also getting some relief from your tinnitus itself. Now let's actually take a look at how you're going to implement sound therapy into your daily life. And I'm going to talk about some important factors. First of all, you need to choose your sound. You want to find a sound that you like to listen to. It could be soothing, it could be calming, it could just be something neutral. But we want some kind of sound you won't find annoying and that perhaps you even find a little bit relaxing to use for sound therapy. You also want to make sure you choose the volume correctly. You don't want sound therapy to be so loud that it interferes with conversation, but you do want it loud enough you can hear it. You need to hear it enough to help offset your tinnitus. You don't want to completely cover up your tinnitus because then it's going to be really hard to habituate tinnitus if you can't even hear it. So the goal is to have your tinnitus, to put that sound therapy a little bit softer than your tinnitus, so you still hear the tinnitus, but not so strong. You want to make sure that you're using sound therapy consistently. The only way for the brain to actually make changes is to have this constant sound stimulation. And if you're looking to habituate to your tinnitus so it becomes less of an issue for you, you need to give your brain some time to do that, and you need to do it every single day. Another important thing is to have some patience with it. Most changes with any kind of hearing issue don't happen overnight. You might get a bit of immediate relief, but for long-term effects, you need to wait some time. It might take weeks, it might take months, but over time, your brain can retrain how it responds to the tinnitus, how it reacts to it, and learn to habituate to it. Here are a few extra tips if you do decide to use sound therapy. It can also be helpful to use relaxation techniques, especially during those moments of heightened tinnitus. Practice some guided meditation, muscle relaxation, guided imagery, or mindfulness. If you have hearing loss, make sure you get your hearing tested. Hearing loss can be an underlying cause for your tinnitus, and if it's left untreated, it's going to be harder for you to manage your tinnitus. Also, when you have hearing loss, it's going to affect your ability to hear conversation easily, which can make your tinnitus feel worse. Avoid being somewhere that's completely silent. You want to always have some level of background noise around you. It doesn't have to be loud, certainly doesn't have to be annoying, but you don't want to be in environments that are completely silent. You want to enrich your life with sound, however that looks for you. Tinnitus can feel overwhelming, but it's not uncommon. Many people have tinnitus. If you're struggling with it, try out using sound to see if it can help you. And if you need more support, certainly find an audiologist that works with individuals with tinnitus and get some more help from them. If you found this video helpful, give it a thumbs up, subscribe, share it with a friend, and if you have any questions, reach out. My name is Alicia at Birdsong Audiology. Thanks.